A set of rules. People will be confused. And again, if you don't like the rule, you get in your car, you drive 15 minutes, you're in a different jurisdiction subject to a different set of rules. So in New York, you cannot shop New York City versus Westchester versus Nassau versus Albany versus Schenectady. It's one set of rules for the entire state. And it should be one set of rules for the entire nation. And that is the role of the federal government and national leadership. And it is lacking. The federal government should put one position in place and coordinate it with the states. If the federal government isn't going to do what it should do, then the states have to try their best, right? And the best way is for me not only to have a uniform policy within the state of New York, but to the extent you can, cooperate with surrounding states so you all have a common set of practices, right? I don't want to close down bars in New York, but Connecticut leaves the bars open. Why? Because then many people will get in their car and they'll drive to Connecticut to go to a bar, which is the last thing we want. Now we have people who are drinking and driving. It makes no sense. I don't want to have one set of rules here and a different set of rules in New Jersey, because then I close down the bars, you'll get in the car, you'll drive to New Jersey. Makes no sense. Well, then get the states to coordinate themselves. Yes, very hard to do. Luckily, we have set a template where our regional states work together. Many of you came to our regional meeting on marijuana laws. And I have a good relationship that I've developed with the surrounding governors. So we have actually deployed that here. And I just did a call with Governor Phil Murphy of New Jersey and Governor Ned Lamont of Connecticut, and we are adopting the same policies. So there is no benefit to try to shop New York versus Connecticut versus New Jersey. There will be no more gatherings of 50 plus people. So if you were hoping to plan a graduation party, you can't do it in the state of New York, you can't go do it in the state of New Jersey, and you can't do it in the state of Connecticut. Casinos, we all have casinos. If I close my casinos, but New Jersey keeps their casinos open, we're going to have the same problem. All casinos will be closed effective 8 p.m. tonight, and they will stay closed until further notice. On all these closings, they are all until further notice, and hopefully I can coordinate with the other governors so we can have the same opening period, just the way we had the same closing period. Gyms are closed effective 8 p.m. tonight. I know that's a specific hardship for the people in this room because I can all see you are in masterful shape, buff even. There are other ways to exercise. Theaters closing at 8 o'clock tonight until further notice. Any bar or restaurant closes at 8 o'clock tonight. However, there is a silver lining for these establishments because we're also very aware of the economic consequences for these establishments. So the State Liquor Authority is going to change its rules. They'll have guidance up by 5 p.m. this evening that will allow bars, restaurants, distilleries to sell their products off premises. So whatever you could get, whatever you could order in the bar or restaurant or distillery or winery, you can purchase through takeout. And we hope that goes a long way towards alleviating any economic hardship. Stay home and order from your favorite restaurant, order from your favorite bar, order from your favorite winery, order from whatever establishment that you were thinking of patronizing. Just order it and stay at home. And again, the State Liquor Authority will change their rules to allow that. It's not currently allowed. We will only allow it during this period of closure, but I think it will help those businesses. As you know, we've done a lot of work with the wineries and distilleries to grow that industry in New York, and I want to make sure we protect them. Now everybody is at home, and they're at home with their kids. My kids are a little older, but I remember the old days when you're in the house with a number of young kids. The house can get very small very quickly. The kids can get very rambunctious very quickly. We're going to waive all park fees in all state parks, local parks, county parks. So you want to get out of the house? Great. Go to the park. The weather's changing. Take a walk. Enjoy your family, and do it in an environment that is not a dense environment, which is exactly what the parks provide. Other actions: all local governments must reduce their workforce by 50% minimum. I'm directing all local governments to allow their non-essential personnel to stay home, work from home, with a 50% minimum. Local government can go higher than 50%, but it must be a 50% minimum. Work from home, which is the same thing I'm asking private businesses. If we can ask private businesses to do that, government, I think, leads by example. So not just for New York State government, which will do this also, all local governments, non-essential people work from home, and a minimum of 50% of the workforce must stay at home. Second, I'm directing local governments to make sure that all their local police departments and emergency management services are supplied with masks, surgical masks. You have police officers who are encountering people in all different circumstances, EMS workers who traditionally wear masks, police officers who traditionally do not. But I was at the New Rochelle drive-through testing center the other day. And, you know, if you're a police officer, you're walking up to a car, you're stopping a driver, they roll down the window. By definition, you're within more than 6 feet. You don't know who you're talking to. People are positive who don't even know that they're positive. I want all the police officers who are showing, all first responders, are showing great coverage, great courage, getting up and going out and doing their job every day. I want them to know that we understand the situation they're putting themselves in, and we're providing the necessary precautions. So every local government must provide their local police department, EMS workers with masks. New York City, Nassau, Suffolk, Westchester, and Rockland must have child care, educational services, and meal programs in place by midnight. We said that those schools will be closing, but we need to take care of the negative, the downside of closing a school. This is not an easy decision. There are negatives when you close a school. Most notably, you don't have child care for essential personnel. You don't have child care for healthcare workers. Remember, please, the greatest challenge and the greatest damage is going to be done by an overwhelmed healthcare system. Nurses, healthcare workers, 1199 members don't have alternatives to childcare. Public education is also this state's child care system. It's this nation's child care system. And it's not that easy to say, well, let them get a babysitter. They can't afford it. It's hard to find. And we would have created a true negative situation if we lost healthcare workers or first responders because we closed schools and they had to stay home with their children. This is solved easily enough. You're closing schools. Don't close all the schools. Leave a couple of schools open or parts of schools open to provide childcare for the essential personnel. We also have to have meal programs and meal services in place and educational services in place. On that condition, I ordered the schools closed. But it's on that condition. And I want those plans and I want them in place by midnight, and they have to be approved. We strongly advise that only services and businesses that are essential stay open after 8 p.m. Grocery stores, gas stations, pharmacies, medical facilities. We want people home. We want less density. We strongly advise this. This is not mandatory, but it is strongly advised. And it's not mandatory at this time. And it may be in the future, but it is strongly advised at this time. Testing, we have had a phenomenal increase in testing. We've been able to use our laboratories. Our emergency management team has done a very good job of reaching out to our state labs, getting them on track, getting them coordinated. Our testing numbers are way up, as you'll see. Next week, by the end of this week, we think we're going to be up to about 7,000 tests per day, which is an exponential increase of what we have done. I made this suggestion to the vice president. I made it to the president. I often tell you when I am unhappy with the federal response to the state. The fairness dictates that kudos where kudos are due. And here the vice president and the president responded very quickly. So I want to thank them for that. We started a drive-through testing facility in New Rochelle, Westchester, where we have one of the highest clusters. It's one of the first in the United States. I believe actually the first on the eastern seaboard. It has worked very well. It's safe for everyone. You drive up in your car, you never get out of your car. You're tested in your vehicle. They take the test kits back. The time that it takes to take the test is actually faster than we thought. Doesn't normally happen in government. We allotted 15 minutes per car. It's actually running ahead of that schedule. We want to replicate that because it's just smart. The worst thing is a person walking into an emergency room. If you are positive, you infect other people. If you're negative, you may get infected by walking into the emergency room. So this is the best way to test someone. We said we were going to open one on Long Island after the positive New Rochelle experience. We're also going to open one on Staten Island. Staten Island does not have an abundance of hospitals. Staten Island is a community where people drive. And Staten Island, I believe, is an appropriate location for this. I also think that Staten Island feels that they have not gotten the level of attention of health services that they need. And I've spoken to Max Rose, I spoke to Senator Andrew Lanza, and I believe this is going to make a difference. We're also open one in Rockland County on the same theory. We're going to a new phase in this entire process. We talked about early detection. We talked about testing. We talked about containment. You see those numbers are going up. That means you're moving towards a mitigation phase, and you're moving to a phase where you must expect a significant inflow into the hospital healthcare system. Now, again, this is the great curve they talk about, plus or minus. Flatten the curve, flatten the curve, flatten the curve. That's what you hear. That's what you hear every day on TV. You see this curve. We must flatten the curve. The concept is right. Flatten the curve, slow the spread so the healthcare system can handle it. When they say this, I don't think of a curve. I think of a wave. And the wave is going to break, and the wave is going to break on the hospital system. We're doing everything we can to flatten the curve. I believe we've taken more dramatic actions than any state in the United States. I believe we've had the most effective response of any state in the United States. I don't believe we're going to be able to flatten the curve enough to meet the capacity of the healthcare system. So in this business, plan ahead, plan forward, anticipate what's coming down the road and get ready for it. Expanding the capacity of the healthcare system for a state is virtually impossible. Building a hospital is a very elaborate, extensive, expensive undertaking. Again, we need the federal government to play its role. The federal government has tremendous capacity. I was in the federal government. I was a cabinet secretary. I worked with the military. I worked with the Army Corps of Engineers. They have tremendous capacity. This is what they do. This is what they do. They build airports. They build bridges. They build hospitals. This is exactly what they do. Deploy the Army Corps of Engineers to come work with states to build temporary medical facilities. Get us backup beds. So when the hospital is overwhelmed, we can have some of the people who are in the hospital beds go to a backup medical facility. It makes all the sense in the world. And if you don't do it, you know what is going to happen. You're going to overwhelm the hospitals. You only have 53,000 hospital beds. You only have 3,000 ICU beds. Why? Because our health system is basically a private system. They don't build capacity that they don't need. They don't build extra ICU beds just in case. An intensive care bed is very expensive. They don't build a wing of ICU beds that sit vacant for 10 years on the off chance that there's going to be a public health emergency and you'll need the beds. They don't. It's not economic. It's not their business model. So we don't have them. We have the capacity that people use day in and day out. And that's not just New York, that's every state in the United States. You now have this influx, you can't handle it. You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing. That is what is going to happen now if we do nothing. And that, my friends, will be a tragedy. We know what lies ahead. Look at the numbers from China, South Korea, and Italy. You don't have to guess. You just have to project. The numbers are on a chart. Our numbers are on a chart. Just extend the current trajectory. Just go dot, 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 and you'll see the numbers rise. And you compare those numbers to our hospital capacity, and it's still math at the end of the day. And it doesn't work. The federal government must do this. Assume the federal government doesn't do what the federal government is supposed to do, which would not be a wild assumption, as it hasn't happened today. Well, then as a fallback, the states have to do whatever they have to do. And the state has to mobilize to create backup medical facilities. And that is what we are going to do. We're going to organize the National Guard, work with the building unions, and work with private developers to find existing facilities that could most easily be adapted to medical facilities. Meaning what? Meaning dormitories, meaning former nursing homes, facilities that have that basic configuration that could be retrofit. Even that is not easy because you have the construction element and you also have the equipment element. It is very, very hard to get medical equipment now because everybody on the globe is trying to buy the same medical equipment. Everybody wants to buy a ventilator. Everybody wants to buy oxygen. Everybody is trying to buy the same equipment, and it's terribly scarce. That's why I go back again to the capacity of the federal government, which operates and maintains a medical emergency stock. They have stocked medical equipment for domestic issues or for wartime. Right? When you go to war and they set up a wartime hospital, they have equipment. They have it stockpiled. That's why they're uniquely suited to do this. But in any event, we're going to do the best we can. I need, first and foremost, to find available facilities that can be converted. And I'm asking local governments, especially in the most dense area, to immediately identify a number of beds in facilities that are available. Frankly, I hope they're surplus because we don't have, this is very expensive and I don't want to pay money for acquisition of property and real estate. But we need the communities that are most effective to begin finding available beds. New York City, we estimate conservatively, we at this point should identify 5,000 additional beds, Nassau 1,000 additional beds, Suffolk 1,000 additional beds, Westchester 2,000 additional beds. Why more for Westchester? Westchester has the New Rochelle cluster, which, as you know, has a significant number of people who tested positive. We will do everything we can, but we need federal assets and we need federal assistance. I am very proud of this state government and what it can do. And we have done things that no state government has done before. We built bridges, we built airports, we've responded to emergencies. But know what you can't do. We don't have the billions of dollars that you would need to implement an immediate emergency hospital construction program. This state can't do it. No state can do it. To increase hospital capacity of the existing hospitals in the meantime, DOH is going to be suspending its regulations to allow existing hospitals to increase their space and capacity. DOH has regulations about how many beds per room, how much space between beds, et cetera, how wide a hallway has to be. Those are going to be suspended so hospitals can actually use their physical space with more efficiency. We're leaving it up to the hospitals for their discretion and prudence in making these decisions. But we do have to get very aggressive about them better using their existing space. I want the private hospitals to be on notice that we may soon be canceling elective surgery. We are not doing it now. Elective surgery is between 25 and 35% of the beds. Some of the elective surgery is critical, some is not critical. The non-critical elective surgery may be canceled on a mandatory basis. I'm asking them now, as a precaution, to start to plan to cancel elective surgery that is not necessary. We will need that capacity in the hospitals when those numbers peak. Michael Dowling, who was the former health commissioner for the state of New York, a phenomenal fellow. He worked with my father and was in my father's administration. He was health commissioner, he was deputy secretary. He's just a jewel of a human being. And he's one of the best healthcare professionals in the United States of America. He runs Northwell now, which is a magnificent organization. But Michael and Ken Rasky runs Greater New York Hospital Association. They coordinate all the hospitals. I asked them to convene all the hospitals and now start developing the maximum surge capacity. So if a hospital's capacity is 500, okay, what if we bring in more beds? How many more beds can you hold? What if we brought in more staff, et cetera? We also have a number of efforts going on finding more staff, more doctors, et cetera, not just for the surge capacity, but also for the additional facilities we may open. These are the new number of tests. We're up to 7,000 tests, so it's a dramatic increase, 1,600 new tests. What happens when the testing capacity increases? The number of positives increase by definition. So the number of new cases has gone up 221 to 950 cases. And you can see New York City is increasing. Westchester is still disproportionate to the population of Westchester. That still represents the New Rochelle cluster. Nassau 109, Suffolk 63, Rockland 16, Albany 12, Orange 11, Dutchess 10, Monroe 9, Ulster 7. Number of new cases, New York City and Westchester. Some in Nassau, some in Suffolk. But you'll see the cases rise in the most dense areas because that's where people are transferring the virus among themselves. Counties with new cases today: Allegheny, Onondaga, Ontario, and Wyoming. So you see the spread continues. Most impacted states in the United States, we are now 950, number one in the country, 676 for Washington State. Again, these cases are more an example of how many tests you're doing and who you're testing, rather than a raw number of cases in that area. Our deaths have increased to 7. Washington is the next highest at 42. Total deaths in the United States, 67. Hospitalizations, 158 out of 950. That's 17% of the cases. When we talk about hospital capacity, just take that 17%. And it's always, if you notice, 14%, 15%, 16%, 17%. Run that 17% against whatever you think the total infected population will be. And then compare that to our hospital capacity. And that will keep you up at nights. Hence, the situation that Dr. Zucker and myself and my colleagues are in. Again, perspective. I went through the numbers in Italy. I went through the numbers in South Korea and China last tonight, you look at all these numbers, they're the same story. You look at the deaths in New York, it's the same story. People who had underlying illnesses, if they got the flu in a normal season, they would be in grave trouble. Instead, they got the coronavirus and they had existing illnesses and they passed away. Remember, of any of this, somebody would pass away in a hospital, an old person, and you would say, how did they die? And they would say pneumonia. Say pneumonia, well, how did they catch pneumonia? Well, it wasn't really pneumonia, it was they had heart disease. They had emphysema. They were struggling with cancer. And then the pneumonia becomes the accelerant to a bad situation. And that's what's happening here. Any of my colleagues, additional points? Why don't you make them? Melissa? No. Robert? Questions?
You said that gyms will be closed. Can you elaborate on that? And also, did you confer with City Hall or Mayor de Blasio on this? Because he was at the gym this morning and just wondering if he knew about the fact that you're going to close down gyms.
He can be in the gym this morning. You can be in the gym this afternoon. You can be in the gym this evening. You just can't be in the gym after 8 o'clock.
Should we be using the gym already as is with social distancing?
Yeah, you can use the gym.
Have you used the gym?
Are you asking me if I go to a public gym? Yeah, I have my own workout routine that I have developed over a number of years that I do alone. So I don't do it in the gymnasium. Go ahead.
I'm sorry, Governor, have you heard back from the White House about the matter of deploying the Army Corps of Engineers?
We're having ongoing conversations, none have been conclusive.
What's the overall prediction or projection for the number of people who could potentially get this in New York? And what's the overall projection for the need for hospital beds? I mean, I know we've got like a cap of like 50,000 or so beds, but what's the need looking like at this point?
Yeah, that's an unfair question for Commissioner Zucker because it's anyone's guess, but I'll recommend this to you. Google that question and you will get a range from 40% to 80% of the population. Merkel said what, 70%? 60% of her population. 40% to 60%. So take 40% or 60% of 18 million, take a hospitalization rate of our sample of about 17%, and then compare that to 50,000 hospital beds. You will then break out in a sweat, maybe hives. You will feel great anxiety, panic attack, and you'll be right.
How does the state work for it? What are the plans in place? I know you have restrictions downstate, but I drove in today. The Empire State Plaza seems to be full. And as you're telling local governments get to 50%, what about state workers here in Albany?
Yeah, that was yesterday's policy. Today's policy is non-essential workers, a minimum of 50% of the workforce for our state government and every local government in the state.
Are you requesting that the federal government shut schools, shut businesses, shut bars, restaurants? It seems like that's where you're headed.
I want federal guidance, Jesse. You can't have one state taking actions that are different than other states. There are ways to do it. You could say, if your state has a density index of over X, if you have more than this many cases, then this. But when you leave it, this is like the reverse federalism. This is a national pandemic, and there are no national rules. So literally, the national news broadcast today would cause somebody to panic. Everybody on their own with all these hodgepodge. Just say, you don't even have to make it mandatory. Just let the federal government say, here's what we think you should do, so I know what Connecticut is going to do and Massachusetts is going to do and Pennsylvania is going to do, or they're likely to do. So I do the same thing. Look how much damage you can do. I close down my bars. Jersey doesn't close down their bars. Everybody drives to Jersey to drink. Everybody drives home. It makes no sense.
By extension, though, did you try to include Massachusetts, Vermont, Pennsylvania, other regional states in this compact?
I did not get there here. You know, we are the tri-state area. We have the most interaction. Obviously, part of New York abuts Massachusetts, and Alan Chartock goes back and forth. Part of it goes, we have contiguous with Pennsylvania example. Also, we did convene them for the marijuana regional discussion. We started here. We will be expanding. But this was quite an elaborate undertaking because you had to align 3 states' policies. So this is not just consultative. We actually all adopted the same policies, Jesse. I don't ever remember this happening, period.
So presumably, does this preempt what Mayor de Blasio announced last night in terms of closings of?
This preempts what any mayor anywhere or county executive anywhere in the state said. The same point I make about the national government is even more true on the state level. You can't close bars in Manhattan, but leave them open in Nassau, because now everybody drives to Nassau for the bar. You have to have one set of rules that are uniform. And that's why in an emergency situation, there's actually a protocol that makes sense. Local governments can set rules, the state can override those rules, and the federal government can override state rules. Because it's not a situation where you can allow all these disparate policies. They are actually counter not only to common sense, but they're counter to public safety and they're counter to public health.
Why not do the same thing with schools then in New York? Why not you just have a blanket policy, they're all closed, like the city, going to be closed
We
April
will.
20th? I mean, you will.
We will.
When is that going to happen?
People that have tested positive.
Okay.
So about 86% of the schools are closed already statewide.
Right.
We have talked to SED this morning. We are closing the remaining 14%. That will go into effect by Wednesday.
So then, is there a date specific as to when they would reopen?
We're starting with 2 weeks and then we'll adjust as it makes sense moving forward.
So by the end of the day, this afternoon, you'll be closing all schools for 2 weeks.
Yes.
Well, yeah, and we'll have an announcement this afternoon on the specifics of that because people want to know exactly how and when and what hour, et cetera.
Why just a 2-week period? Obviously, New York City's closed for, a month or so. Why just start at 2 weeks and then reevaluate it? Is that kind of-
Reevaluate, that's all it is.
The
And look,
calibration.
if in 2 weeks, miraculously, everything is fine, I'll reopen every school in New York in 2 weeks. So,
So 2 weeks, all schools in the state closed for 2 weeks at least.
yeah, I haven't communicated with SED yet, Jesse, so that's what we're planning. We will have specific guidelines that we announced this afternoon.
The 950 people who have tested positive for coronavirus, have any of them self-resolved or gotten better at this point?
Sure.
Sure, we've actually had patients discharged from the hospital. 16 have been discharged from the hospital. And I am sure there are many people out there that we have not tested who've gotten coronavirus and have gotten better that are out there in the community. And is
Of like how many people have tested positive and how many people are now?
we're tracking all of that information, yes.
Excuse me, just look at these numbers, please. Where are they for you? Since it started, 169,000 cases, 77,000 recovered on the 169 since it started. 85,000 are pending, which means they're still ill. 6,000 passed away. I'm sorry.
What about mass?
Just to go back to Jesse for a second. Jesse, I want a uniform policy on the schools also, because, you have two-parent families who have children in schools, businesses that are operating that have employees with children in different school districts. So we want to get a uniform school closing policy also, and that's what we're working with SED about. So hold on the details of the school closing policy, but we will be closing all schools. That is true, and I then want to have a uniform policy so we have a semblance of normalcy.
Is that sort of similar to what you're doing downstate? You want to ensure that there's childcare?
Yes, sir.
Meals?
Yes, sir. And I want to make sure every school district is in a position to do that, and they know it's coming and they're preparing for it.
To suspend their billing practices while they're closed. Asking
Did
for-
gyms?
Haven't been to the gym in a while.
My gym did, but I don't have,
Governor,
but I don't know what the other gym's policy is going to be.
Governor, what's going to happen with the budget at this point? And should there be money set aside, like a rainy day fund set aside for when we're still dealing with this several months down the road?
There should be a rainy day fund set aside. There should be a snowstorm fund set aside. There should be a fog fund set aside. Yeah, all those set aside should be done. Obviously, I'm kidding. The budget, I asked the controller to give me his re-estimate of the revenues. Let's just take a second on this because it's important that you understand. The essential element in the budget is the projection of revenues. And that's why there's always a disagreement on the revenue projection, and we have this whole elaborate process to come up with a consensus revenue forecast. We did a revenue forecast. Since we did a revenue forecast, the world has changed 180 degrees 3 times, okay? I asked the controller for a revenue forecast, he's doing it. You turn on the television, you look at the stock market, you tell me what the revenue forecast is. My best guess is our revenue forecast was outrageously high compared to what is going on. How high, who knows? Rob Mahika, who can be an optimist for very brief intervals of time, says that there's a theory that the market is a V. It dropped quickly and it's going to come up quickly. That's a theory. What is the effect of these businesses that are closing down? How much revenue did they lose? And how much less tax revenue will we get? How many people will be laid off and not earning income? And how much tax revenue will we lose? There is no doubt that the revenues are going to be way down. So rainy day fund, that was my attempt at humor, have a rainy day fund, a number of reserve funds. That is very true. On top of that, you have the Medicaid redesign team coming back, which is trying to close what was already a $2.5 billion hole. We now have a new complication that could only happen in a world of total chaos. The federal government is passed the first coronavirus bill, which I have lamented, $8 billion. New York State only gets $35 million. Then now passing a new coronavirus bill. In that coronavirus bill, New York State gets the lowest level of reimbursement. They do it based off the Medicaid funds. New York State gets 50% of their Medicaid funds reimbursed. Some states get 75%. No state gets less than 50%. In raw dollars, we do very well, but that's only because we spend more than anybody else. But in that bill, they tucked in a provision that said you can make no changes whatsoever to your Medicaid program, which means, if you want to take the literal approach, the MRT, which is recommending changes in the Medicaid program, cannot be accepted because of that federal bill. Why the federal government would have passed the written in language that says you can't make any changes to your Medicaid program, why our New York delegation allowed it, when they knew in January we had an MRT, Mike Downing and Dennis Rivera were heading it. The second time we did it to find improvements, I have no idea.
I read those provisions. My read was that there's one that basically says you can't cut benefits for people, which I don't think you were hoping to do anyway. And the other one says you can't do what you tried to do, which is shift more of the share of cost on counties. So counties are, in the city of New York, are delighted that you've lost on the second
I
provision.
understand your position. Would you like to make a wager, my friend, that you are incorrect?
But I read the bill and I talked to the
Okay.
Senator Schumer's
I know,
office.
we went through this. Oh, okay, so you want to make a wager that you are wrong.
Casinos, I don't think you can.
That's,
I will wager you that you are wrong, that you misread the bill, that the bill says you can't make any changes to the Medicaid program, which would preempt the MRT changes. I have no doubt that they did it as political protection. You're half right. They did it for political protection so the counties wouldn't have to pay anything more, which is ironic, by the way, since we voluntarily now pay all the excess from the counties, which we did on our own. The federal government never said you should pay all the increased costs, but they now want to tell us you can't raise it. It also said, do you have the language here? Wait, don't read it yet. How much are we wagering?
I'll make you here.
Okay, read the language.
Yeah, it says you can't change any eligibility standards or methodologies. It also says you can't make any changes to enter any of the enrollment standards going forward. It talks about making changes to any premiums.
I'll take the beer right now, as a matter of fact, because you're not going to be able to give it to me after 8 o'clock.
And it also refers to any kind of income checks or any qualifying checks. So it goes on and on. But it basically limits substantially the ability of the MRT to do what the MRT was intended to do.
And here's the problem, Jimmy. Without the MRT, you can't balance the budget. So I spoke to Senator Schumer. They tried to say, oh no, all we did was protect the local governments in New York City. This provision goes well beyond that, says no MRT. You can't do a budget without the MRT. Now we can't do a budget until they fix that anyway. I spoke to Senator Schumer. I spoke to Congresswoman Lowy. I'm calling Congresswoman Speaker Pelosi. But it was a terrible blunder by the federal government. And it makes it impossible to do the budget, and they have to fix it, and they have to change it.
Last question. Speaking of that, the Senate and Assembly just canceled session for the day, postponed till at least Wednesday. I know you had some bills that you wanted them to do this week. Does that put a crimp in your plan?
No, Wednesday's fine. April 1 is the budget.
But didn't you have things like this week with the petition gathering numbers and paid sick leave?
No, I did the petition by executive order. That's done. Well, what they don't pass is the paid sick leave, which also gave people pay for their quarantine period. So I'm sure the people who are in quarantine and wanted to get paid wish that they voted for the bill so they could get paid.
Governor, you waived the 7-day waiting period on unemployment benefits. We're hearing reports that.
On what, I'm sorry?
On the unemployment benefits.
Yes, sir.
It seems like people going to the website can get it on the website, but then they're told to call a number, and they're saying that the wait could be several days before they hear back from DOL. So can you kind of address that? Is there anything being done to fix that?
I have not heard that, obviously, but I will check forthwith. Shouldn't be.
Just go back to Medicaid, because I've got a beer on the line here.
Yeah.
No,
No, you lost the beer.
We've applied for waivers in the past successfully. What makes you think you couldn't come up with a way to do this that would also be
Okay.
eligible for a waiver?
Okay, you want to go double or nothing on that question?
Yes.
On what theory could you apply for a waiver for a law that is not changed and be granted the waiver in time to do a budget for April 1?
You come up with the plan, you bake it in, you do a contingent on a waiver, much like the budget you
I
proposed
do a
earlier this year.
budget contingent on a waiver?
Proposed the budget earlier this year contingent on a waiver.
2.5 billion? Maybe we'll get it, maybe we won't.
Earlier this year.
Never.
You did it earlier this year.
I never had a $2.5 billion contingency. You couldn't get it rated.
Does the closing of casinos affect the racinos too, as well as David Downs and Sherco casinos?
Who knows that?
Governor,
Rob?
Does the closing of the casinos affect the closing of racinos as well, such as Batavia Downs or the Saratoga Casino?
I believe it does.
Yes.
I believe it does.
Two beers, Jimmy, 2 beers.
Have you done modeling on this thus far, and can we anticipate how many cases, or can you share how many cases we can anticipate?
We actually are working with some of the associations on a modeling to try to figure out exactly where on that spectrum this will fall, both in New York as well as on the national level.
But Jesse, if you take your story in the, you didn't write it, your time story on projections, it answers that question. See, the range is so broad. If you go from 40% of the population to 70% of the population, it is so broad. And the hospitalization rates tend to be somewhat predictable. China will tell you their hospitalization rate, South Korea will tell you, Italy will tell you. The overall universe, they can't tell you the 40 to 70. But if you start with, if you go to 40%, if you go to
People on this side.
any projection, you are, it's an avalanche on the healthcare system. Any projection. I mean, it's like hundreds of thousands.
how many deaths do we have recorded?
7.
7, whereabouts are they? How many in the city?
There are 5 in New York City, 1 and 1 Suffolk.
Also, the bars and restaurants closure, how does that impact the
So you
cities?
cannot ask 3 questions about bar and restaurant
I'm gonna
closures.
try.
I'm just saying it's, go ahead.
I'm Irish. So how
You
does
said
that
it.
impact the city's executive order that de Blasio announced last night, is supposed to go into effect tomorrow?
This is a statewide executive order. Different governments may have different executive orders. This one overrides all executive orders.
Also, is your gym at home or where is that?
I'm going to take you to my gym one day.
Plans to close the subway.
I'm sorry.
Governor, given the uncertainty around the budget, and all this talk about Medicaid, are you still pushing for a bond act this year?
Yes.
Similar question for marijuana.
Yes.
Anticipate that bail and marijuana will both be in the budget?
Yes, we're here. We're doing our job.
continue for at least 2 weeks after symptoms disappear. Visitors should not be allowed until the end of this period. There are more details in WHO's guidance. Once again, our key message is test, test, test. This is a serious disease. Although the evidence we have suggested that those over 60 are at highest risk, young people, including children, have died. WHO has issued new clinical guidance with specific details on how to care for children, older people, and pregnant women. So far, we have seen epidemics in countries with advanced health systems, but even they have struggled to cope. As the virus moves to low-income countries, we're deeply concerned about the impact it could have among populations with high HIV prevalence or among malnourished children. That's why we're calling on every country and every individual to do everything they can to stop transmission. Washing your hands will help to reduce your risk of infection, but it's also an act of solidarity because it reduces the risk you will infect others in your community and around the world. Do it for yourself, do it for others. We also ask people to express their solidarity by refraining from hoarding essential items, including medicines. Hoarding can create shortages of medicines and other essential products, which can exacerbate suffering. We're grateful to everyone who has contributed to the COVID-19 Solidarity Response Fund. Since we launched it on Friday, more than 110,000 people have contributed almost $19 million. These funds will help to buy diagnostic tests, supplies for health workers, and support research and development. If you would like to contribute, please go to who.int and click on the orange donate button at the top of the page. We are also grateful for the way different sectors of society are coming together. This started with the Safe Hands Challenge, which has started celebrities, world leaders, and people everywhere demonstrating how to wash their hands. This afternoon, WHO and the International Chamber of Commerce issued a joint call to action to the global business community. The ICC will send regular advice to its network of more than 45 million businesses to protect their workers, customers, and local communities, and to support the production and distribution of essential supplies. I would like to thank Paul Polman, Ajay Banga, and John Denton for their support and collaboration. WHO is also working with Global Citizen to launch the Solidarity Sessions, a series of virtual concerts with leading musicians from around the world. This is the defining global health crisis of our time. The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity. Crises like this tend to bring out the best and worst in humanity. Like me, I'm sure you have been touched by the videos of people applauding health workers from their balconies, or the stories of people offering to do grocery shopping for older people in their community. This amazing spirit of human solidarity must become even more infectious than the virus itself. Although we may have to be physically apart from each other for a while, we can come together in ways we never have before. We're all in this together, and we can only succeed together. So the rule of the game is together. I thank you.
Thank you very much, Dr. Testa, for these remarks. I will remind journalists who are dialing in by phone, it's *9. Those who are watching through Zoom, it's clicking raise hand. If it's possible, really, to have one question per journalist, so we can get as many questions as possible from different people. And we will start with Jamil Chade from Brazil. Jamil, can you hear us?
Yes, perfectly. Thank you, Tarek. Hello, Mr. Tedros. My question is about Brazil and about the fact that President Bolsonaro yesterday on the weekend not only helped to call a mass protest in several cities of the country, but also took part himself in one of them. How do you see this as helping or not fighting the virus? And what is your suggestions on protests, street protests, in this case, specifically that we are? Thank you very much, sir.
So thank you for the question. What we know that will be helpful during this time of COVID-19 in terms of what the DG just said is everything that we can do to reduce the possibility of transmission between people. And one of the ways that countries are doing this is to stop gatherings together. And some countries have taken different decisions based on the number of people where they've restricted those gatherings. And so it's important that people do restrict themselves, to go to gatherings where there's large numbers of people. And in doing so, that will reduce the possibility that people who come in close contact with one another can potentially transmit the virus to one another. And so taken together with testing and aggressive case and contact finding, it's important that we limit our participation in mass gathering events.
Thank you very much. Just to remind that Dr. Mike Ryan is on phone. Dr. Ryan, if at any time you would like to add something, just unmute your phone and start talking. This time, so we will go for next question, Gabriela. Can we hear Gabriela? Do we have her online?
Yes, hello? Yes. Hi, thank you. Do you hear me? Okay. So I'm Gabriela Sotomayor, Mexico Proceso. My question is regarding Mexico. There are 53 cases and 170 suspected cases right now. But looking at the fatality rate with older people and people with diabetes, for example, in Mexico, there are 12 million of people over 60 years old and around 8 million with diabetes. So with this scenario, what measures should Mexico be taking at the moment? Thank you very much.
So I can start with this, and perhaps Dr. Tedros and Mike would like to supplement. The measures that we would advise for Mexico are the same measures that we would advise for all countries. And what we are aiming to do in our advice is reducing transmission for individuals, reducing transmission for young, healthy people, but also reducing the possibility that we are potentially infecting vulnerable populations. We have adequate data now from a number of countries which have shown that people of older age, people above the age of 60, of 70, of 80 years old are at a higher risk of death. We've seen evidence from multiple countries that people with underlying conditions, such as diabetes that you just mentioned, such as cardiovascular disease, such as underlying chronic respiratory disease, are at a higher risk of death. And by reducing the possibility of transmission of yourself, you're reducing the possibility to reach transmission to vulnerable populations. So the measures that we recommend are the same. These are fundamental public health measures. It's testing. As Dr. Tedros mentioned in his speech, it's finding all cases and testing cases, making sure that they are isolated and that they are cared for in medical facility. And if that's not possible, to make sure that they are adequately cared for at home and preventing transmission to loved ones in their household. It's making sure that we have adequate numbers of labs that can test individuals and have testing kits that are available in all countries. It's using the basics, hand hygiene, respiratory etiquette, sneezing into your elbow or coughing into your elbow, coughing into a tissue and then putting that into a closed bin and washing your hands. It's practicing social distancing, making sure that you remain separated from individuals, especially if you are sick individuals. It's staying home if you are unwell. It's working from home if possible. It's mobilizing your populations. All of the same measures that we've been saying every day are the same measures we would recommend for Mexico as we would recommend for every government across the globe.
Yeah, no, thank you. Maria had already said it. The only thing I'd like to do is stressing on some of the issues. One, for any country, one of the most important things is the political commitment at the highest level. Because this pandemic is not about the health sector alone. It touches almost all sectors of the government, and the whole of government approach involving all sectors and led by the principal is very crucial. And that whole government approach should also be able to mobilize whole society and make sure that this response becomes everybody's business. Anyone in Mexico, this is, something that can only succeed if all Mexicans actually be involved. But this is not just for Mexico, but the whole world. It's everybody's business, and that's what we're suggesting to the whole world, and it will be the same for Mexico. And we hope to see a progress in the whole of government approach, whole of society approach, and making sure that this is everybody's business. That's how we can stop this virus.
Thank you very much. Dr. Ryan, would you like to add something?
No, Tarek, I think Dr. Tedros said it right on the spot.
Please jump in anytime you want. I will go now to a question from Norway that we received via text. It's Henrietta Haynes, and I'm sorry if I don't pronounce well. The question is for Maria, and it says, Maria, would Maria be able to comment on the new aerosol study and various surface studies, or possibly provide a general update on what do you know today? That's from Henrietta Haynes from Norway, NTB, and The Journal.
So Henrietta, thank you for that question. That highlights the evidence-based nature of our organization and what we are trying to do in terms of making guidance for all countries. And we try to pull together all available evidence on different topics. This one that you've mentioned about the role of virus persistence on surfaces and the potential for the virus to remain in the air. So we are aware of several studies that have been published, that are in the process of being published, and that are currently underway in labs in a number of countries that have looked at different environmental conditions in which the virus could persist, looking at maybe different humidity or different temperature, UV light, and that have looked at different surfaces such as steel, hard surfaces, and looking at the new virus, the new COVID-19 virus, as it compares to other coronaviruses like SARS or like MERS or the common cold coronaviruses that are circulating. And there is a recent study that came out that looked at the role of aerosol generating procedures, how would those viruses, as you know, this is a virus that is transmitted through droplets. And so these are little pieces of liquid that come out of people's noses and mouths if they cough or they sneeze and they talk. And what we know about droplet transmission is that when they come out of an infected person, an individual, is they go a certain distance, but then they settle. And so that's why we have the distance of the 1 to 2 meters apart from individuals. But when you do an aerosol generating procedure, like in a medical care facility, you have the possibility to what we call aerosolize these particles, which means they can stay in the air a little bit longer. And in that situation, in healthcare facilities, it's very important that healthcare workers take additional precautions when they're working on patients and doing those procedures. But for the everyday person, it's the talking and the sneezing and the coughing, which is why we want the respiratory etiquette. So I think I'm speaking too long, but these studies are looking at how long these viruses can persist in the air. And the one study that came out looked at the aerosol generating procedure and said that when you do those, that these particles could stay in the air longer than they would if you were just normally talking to someone. So we use this information to make sure that our guidance is appropriate. And so far, from the available studies that we have seen, we are confident that the guidance that we have is appropriate, which is so people who are in the communities, they don't wear a medical mask unless they themselves are sick, because this prevents them from infecting someone else. But in healthcare facilities, we make sure that healthcare workers use standard droplet precautions, with the exception if they have they're doing an aerosol generating procedure, and then we recommend airborne precautions.
Thank you very much. I think this is very important to provide to our journalists information on what we know. Let's go to the next question. Adrian from Romania. Adrian, can you hear us?
Yes, hello. From Protein, Romania. Authorities in China and South Korea have decided to isolate the areas affected by coronavirus and have managed to reduce the number of infections. But the European report keeping the borders open. What is the best solution recommended by the World Health Organization?
So we recommend that all cases and all contacts are followed. So if with the aggressive case finding and testing of cases, we will know where the virus is. It is important for countries to know where the virus is circulating within their countries and who is infected and who is not infected. By all cases and isolating them, providing adequate care for them, by following all of their contacts and making and testing those contacts to ensure that we find any possibility of onward human-to-human transmission. By doing so, you can effectively stop transmission between people. In addition to that, rapid testing, immediate isolation of individuals so that you're taking them away from other individuals that they can infect. This is the most effective way that we can limit human-to-human transmission. In addition, as what the DG said, is high levels of political support, making sure that there's an all-of-government approach. It's not just the health sector. It's involving all different sectors of the government to repurpose themselves to fight this virus. It's ensuring that every single person in the country, in China, in Korea, in every single country knows what their role is. How can I protect myself? How can I protect my family? What role do I have to play in actually preventing onward transmission? And some of this does involve self-isolation. Some of this does involve making some sacrifices that you don't participate in social engagement. And we've said this before, it's going to be difficult for a while. It's temporary. And it's important that we all play a role in this.
Yeah, no, thank you. I have spoken to many ministers from Europe, especially, of course.
Video. They choose to be with whoever they want to be with, that's fine. I'm surely not making videos of whining and crying about why they're not choosing black women. I don't give a shit. The only ones that's crying and whining about how these dudes are choosing them are the man pygmies. If anything, you should be crying because the dusties that's left over, there are plenty for. things out there. Don't make the same mistakes as my generation and the generations before us. You go out there as a black woman, hold your head up high, and you go with a man that's going to love you and respect you. Forget the skin color. There are good men and bad men of all races. Don't sit there and let you should be with someone solely based on being black. And I hate when they sit there and say, oh, the black race is dying. No, it's not. We've had interracial dating and marriage all this time, and nothing has happened to the black population. So get out of here with that bullshit. It's funny that you said that spring flower. Because I was reading somewhere about they were talking about coronavirus, and you know, people were talking about what they're going to do and how they're going to prepare, and it's black women, and they kept getting evicted from place to place because neither one of them held a stable job, especially not the man. And you're going to see these situations pop up again. Instead of them telling you as a black woman to be where you're loved and respected and to have your priorities in order, they want you to settle for dusty lovers. They want you to settle for felons. They want you to think based on skin color. And I don't care what anybody says. If you date someone based on skin color first, then you're a bigot, because it has nothing to do with skin tone. Yes, we all come in different races, but we should be respected as well as respect. It's ridiculous. If you are a black woman dating outside your race, you better cut these negative people off, because I'm telling you that with that negative mindset, they will do everything they can to destroy your marriage and destroy your relationships out of pure hatred and jealousy. So all I'm gonna say is to you, mammies that pick me, focus on yourself. We get it. You don't like black women that have a mindset of their own, who do things individually, who have decided to be with whoever they choose to be with, not based on skin tone, because we choose not to look at skin tone first, because we look at better options. So you're mad at black women who have stepped up to the plate and they've opened up their options. They decide to leave the struggle love behind. They decide to leave that bull crap behind. We get it. You don't like us. We don't care. 2 middle fingers up to you women. Find something else to do. If struggle love is what you want to talk about, deal with it. But I swear to you, if I see a social media post of a black woman whining and crying about how black men don't want them, but at the same time want to talk shit about black women who date outside their race, I'm going to flip the hell out. That's why I don't deal with a lot of black women. This is why. Because you're basically not looking for the best interest of black women. You are only looking and talking out of your own ass. Exactly, Swingflower. So tell me what you guys think. Like, comment, share, subscribe. Hey, Juanita. Well, here in the DC area, they started doing that in Maryland. I'm not in Maryland, but if you are in the Maryland, the state of Maryland, effective 5 p.m. today, all restaurants are closed, schools are closed, by the way, gyms are closed, movie theaters are closed. If you want to eat something from a restaurant, you can, but only do delivery or drive-through. So if you are in Maryland, just know that. And that goes into effect today at 5 p.m. Exactly, Nyla. Thank you, Lord. That Juanita? Because I actually see that happen in New York. And I believe they're going to do that in Maryland next. It's going to get ugly out here. Oh, and you want to know what? This is basically what I just talked about. It's a one-sided loyalty. Because Black women have one-sided loyalty to these dusties. And these dudes do not share the exact sentiments. And that's why, until these Black women wake up, will always fail. Yeah, I don't understand that. How you gonna be mad at these dudes that called you a Rottweiler? They disrespected you. They wouldn't call a white woman that. They wouldn't call any other non-black woman that. But then you want to cape for them next week? Get the hell out of here. So she can join the club with the rest of these men because pick meats. All right, you guys. So thank you for joining me. I was trying my best to make it as quick as possible. I want to thank you guys so much for listening and tuning in. Please like, comment, share, subscribe. Continue to share my content. Get the likes up. Get the subscribers back up. Let's do the damn thing. Stay safe, and I hope you guys enjoy the rest of your day. Be safe out there, and I will see you on the next one. Thank you, Lord, and I will see you guys again soon. Bye.
COVID-19, the response is really encouraging. At the initial stage, we were a bit worried, but now we're getting almost close to the funding we asked for, and we expected. We expect more support, and the announcement from US is really significant, and we will expect actually more countries to contribute. But we're almost close to the funding we asked based on the SPRP. Of course, the initial focus was on governments, and we appreciate all governments who have contributed. Now we have already moved to asking contribution from the private sector and all citizens. And as I said in my speech, more than 19 million has been secured actually in a couple of days from the private sector and the global citizens at large. And this is in 2 days, and we expect that this will, there will be a significant contribution from the private sector and the global citizens at large. So as we have said, propose for each country to follow or use a whole of government and the whole of society approach, we're using the same thing globally to mobilize all governments to contribute and also all citizens to contribute. And the contribution so far is significant and encouraging, and I know we will get the amount of funding we need. But I would like to use this opportunity, because you have identified US specifically, use this opportunity to thank the US government, other governments, the private sector, and all global citizens for their commitment. We're all in this together. It's a common enemy, and it's our unity that will break this virus. And the last few days I have seen how the human spirit is so amazing, and how it shows us that the spirit can break the virus. So it's not just the funding, by the way, it's the human spirit, which we see, the human spirit that's fighting this virus, which is coming more and more or stronger, that can help us to fight it. When there is unity and solidarity of spirit, and then the resources and other things can come. So I'm really encouraged, especially the last 1 week or so, with the solid level of solidarity that I see.
I just want to add, because the U.S. public health service is one of the finest in the world, and not only has served the U.S. well, but over the last 50 years has helped to train and develop public health systems all over the world, field epidemiology training programs, laboratory networks, and others. The National Institutes of Health, an amazing platform for